Hello, and welcome to The Rightest Leftist with Nathan Ogilvie, the podcast for the politically homeless. In this episode, we're going to be covering the mental health system and why it is such a mess, especially in the context of Australia. A background on me, if you haven't seen any previous videos, I'm a registered psychologist working in Melbourne, Australia, and I have a lot to say on the topic of the mental health system. And so the purpose of this video is to provide a really brief and broad overview of the mental health system, and I plan to expand it out into a bigger series of videos in a practical way in terms of what we can do to make the system better, because I don't want to be a wine merchant and complain about the broken system and leave you with a feeling of hopelessness and despair that nothing can be done, because I think a lot can be done. Some of the solutions are quite simple and others are much more complex. It's a multifaceted, complex system that we have in Australia. And I will have some experts on, I hope, in the near future to talk about it. So fellow psychologists, maybe some psychiatrists and other people working in the mental health industry to talk about what is broken about the system and what can be done to make it better, because we are in a mental health crisis in Australia and we need our government and politicians to take it much more seriously and do much more about improving and fixing that system than they're doing at the moment. So just to quickly outline the mental health system in Australia, there's this model. It's not the only model, but it's one that I think is quite easy to understand where the idea of mental illness even comes from. And so the fancy term, the diathesis stress model of mental illness, and the term diathesis basically just means how vulnerable are you to suffering from mental illness. So that can be from family, like hereditary in your genes, or your biology, certain predispositions you might have to experiencing a mental illness, and then the amount of stress that you experience as an individual as well. So the idea being, if you have a low vulnerability to mental illness and a high amount of stress, you're not that likely to develop a mental illness, as you can see in that graph there. Or if you have a high vulnerability, but your stress levels are lower, you also may not experience mental illness. But it's when that vulnerability and the amount of stress both start to go higher when individuals become much more susceptible to suffering from mental health issues. In Australia, we use a stepped care model, and I know a lot of people don't like to be putting boxes, and I don't particularly like to do that either, but it does really help to sort of highlight the different groups when it comes to talking about mental health. So at the first step, there's the well population, or the mentally healthy population who don't have mental health issues. As you can see, that's a smaller box because it's a not as big amount of the population. A large number of the population don't experience mental health issues throughout their life, and good for them. But as we step through, we start to get to the different levels of mental illness. So we have the at-risk groups, which have early symptoms of mental health issues, or also maybe they've recovered from their mental health issues, so they're back to managing their mental health well. But if they've had previous issues, they're likely always going to be in that at-risk category. Then we have mild, moderate, and severe mental illness. And the way it works in Australia is we have different support systems and services available depending on where people fall in that stepped care model. So a bit of a bigger highlight of it here. So there's that breakdown of percentages as well. So 64% of people can self-manage their mental health. So that may mean that they don't have mental health issues at all, or their issues are so mild that they can perfectly manage it on their own without support. Then the low intensity services for the people with mild mental illness, that's 12%. The moderate intensity is about 16%. The high intensity services is about 4%. And when we're talking about high intensity, that often means that they're probably in some form of therapy or seeing a psychologist and psychiatrist, but they probably also have some kind of case managers as well. So they may be in the community, living at home or living with family, but they have a bit more of intense services around them. And then there's the acute and specialist services. And at that point, that's 3.5% of the population. At that point, they're often in psychiatric hospitals, or in prisons, or in some form of a care, like with NDIS and disability housing and things like that. So then needs are different. The services that they need are different. And that's kind of how we group them up in Australia. So Here's a little chart that I've worked on developing with my friend ChatGPT. I inputted all the information and it's printed out this sort of 6 lists of issues about why the mental health system in Australia is such a mess. So we have that fragmented system because funding and services can be funded at different levels, from the federal government down to the state government, and with hospitals and public and private. It's a very fragmented system. It is chronically underfunded. So governments, the Labor government this election promised $1 billion in funding. But if we compare that to the other things that they fund, $1 billion, if you're an individual person listening to $1 billion, it sounds good. But when we're in a country of nearly 30 million people and you start dividing that money up, it's actually not that much. The wait lists and access inequality. So there's really long delays and long wait lists for services, especially if you're in remote or very remote areas, and also affordability too. So there are a lot of private services out there, but there's a proportion of people who could use those services but aren't because they can't afford it. There's an over-reliance on crisis services. So we're very much more an emergency-based system, and that means we're relying much more on police and emergency departments. So often people are getting that help, or the mental health issues are escalating so badly that it's coming out as aggression and violence or family issues that the police are having to deal with. I've got a couple of friends who are police. I don't know if they'll come on to this context of this show and talk about it, but it's a huge issue for police, and they all know it, that oftentimes they're dealing with mental health issues or family breakdown issues that are all related to mental health. And so we're relying on those crisis services more than early prevention. Policy instability and the bureaucratic complexity, that goes back into government. There's been so many reviews and royal commissions and reports on mental health, and it does feel like a lot of the time not much is getting done about it. And often it's just short-term fixes, and then the next government comes in and does another short-term fix, and there's no real long-term plan or strategy for mental health in Australia. And that's something I'm really passionate about, and doing all I can from my point of view as just a private practice psychologist, is that we need this consistent approach in Australia, because this fragmented system is really no longer fit for purpose for individuals who are struggling with their mental health. And anyone who has struggled with their mental health and had to use these services, they all know that too. It's a real mess of a system. And something that does get missed too, that I just mentioned before, the inadequate prevention and early intervention. It's so much of a focus on treatment and the medical model, which is like that mental illness is a sickness to be treated, rather than focusing on positive mental health and optimal mental health in the bigger context of physical health, social and spiritual health, and these broader concepts of, it's not just that you have depression and you need to take this pill to feel better. There's so much more going on in terms of the treatment and at early prevention too, especially. And that doesn't just mean kids, toddlers, kids, teenagers, but even with adults too. And it's a community-based issue as well, as recognizing mental health or mental illness signs in people, and that people are struggling, and helping them out with the services. So there's things like Are You OK Day in Australia, which recognizes that suicide is a huge issue, or mental health issues. A lot of people often stay quiet and don't connect. It's a big thing with depression, is the social isolation. People might be struggling with issues and not sharing or talking about it. And that campaign is to try and raise awareness and to encourage people to have those conversations, to ask, are you okay? So those social determinants, it says there on the image that they're ignored. I don't think they're fully ignored, but it's something as a society talking about mental health and reducing the stigma and letting people know it's much more common. As we saw in the last one, at 64% of people of the population manage their mental health without needing services. So that's a third of the population. So 1 in 3 people utilize some form of mental health services. So it's incredibly normal. And out of those 64% of people who self-manage, they're probably still utilizing some form of informal resources, whether it's self-help books or online resources, or they just know what they need and manage their mental health on their own. It doesn't mean that 2 out of 3 people are also struggling in different ways. For me, my opinion is that everyone could use seeing a therapist, and I would think 100% of people have different struggles from time to time. Whether that's grief from losing a loved one, loved one, or seeing things on the news that are horrible and shocking, stuff that I talk about here and all of that, it seems like we're starting to turn the tide on that in Australia. And I think another generation or two, so in 20 to 40 years, it'll be totally normal to talk about. But where we are right now, we need to start turning that tide a lot more quickly, I think. So there's this turn, and this is one of the biggest issues in the mental health system, and something I think, I've been working passionately to try and come up with solutions to as well, is the idea of the missing middle. Because if you look here, this is the line there is basically, if you're listening instead of viewing this, when the line's lower, that's people not getting services. And when the line is higher, it's people accessing services. So as you can see, the general population, the line is very low because they don't necessarily need the services. They're usually self-managing their mental health, so they don't really utilize it. But then as it goes up, so what happens is people with mild mental health issues do utilize a lot of services. And so there's many reasons for that. That could just be because their issues are so mild, they can just go to one session of therapy, or they can use their local council. They might have a free counseling service that there's a long wait list. Maybe it is like a 3 to 6 month wait list, but they can wait for that. They're not really needing it desperately. So they can just use those lower level services quite readily. So we'll just skip over the moderate for a second, go straight to the severe. So the line goes back up when we talk about severe mental health. And the reason for that is because at that level, they're so badly managing it. And whenever I say badly, to sort of blame them, the mental health issues are so severe that they cannot function day to day, and they do need to end up going to a mental health support service, like going to a psychiatric unit, or it might be where police do start getting involved in their lives because they can't manage it. Maybe that is coming out as aggression and violence. Maybe it's coming out as a mental breakdown, and they just can't cope. So the people with severe mental ill health often do utilize services quite highly. And things like substance use and all that come into that as well, where a lot of the time that goes hand in hand, and they get to a point where they just can't manage. And so they end up using those services. But the missing middle is this huge issue in Australia, where people who have that moderate mental health issues, so they're not at the lower level where they can, function readily day to day, or be on the wait list for services and don't need that support quickly, but they're also not so severe that they can't function at all, or really struggle to function, where they need support to get through the day to day. They're suffering and struggling while also being functional. And so a lot of the time, it can be a surprise to their friends and family members that they are struggling with their mental health if they reach out. But what it can also mean is that there is a lack of services in this area for these people, because a lot of the time they describe it as they're too mentally well for the intense services, but they're not. Their mental health. Sorry, I'm going to get that. I'm confusing the phrase. They're not struggling enough that they need those severe services, but they're struggling more than they can just use those basic services like self-help. And so that's where people like myself, who are private therapists and psychologists, come in to the picture, is that we really do service that missing middle. Like, I definitely service the mild people. I'll have people come in for 1 session or 2 sessions and they're good to go. They just had one specific problem, or they just needed to talk things out, and then they're fine. Or I have people that come in on the other end that are really severe, and I recognize it quickly and they need that greater support straight away. And then I refer them on to those more intensive services. But the people that need that support, that's where they all fall in. And then that's where we get this bottleneck, especially around the psychological services. There's not enough psychologists and mental health workers, or maybe I should say qualified and effective ones, that are able to handle the load of that amount of people in the missing middle. The other issue that we can't ignore too is around finances and the economic situation in Australia. And that's where, my whole thing about the everyday Aussies, that we're struggling. And then I think the current Labor government, they want to they're talking about it. They're trying to address the mental health crisis. I don't think they're doing it enough. But the funding of these services is abysmal. Medicare covers almost $100 for a private session, but as we're about to see, the fees of psychologists, just because it is a competitive marketplace and psychologists have to set a certain fee to be able to run a business, people can't often afford that gap because there is a gap in the fee. And then the ones that want to use free services, well, they're so bottlenecked up from either people with the mild mental health issues or the severe, who those ones who are higher up are using more of the public services. That missing middle don't really get, because they're not severe enough to need the intense services, and then they're not mild enough that they need the mild services. They sort of miss out in a way, and it's a huge issue that we do need to address. So just to confuse everyone, this is sort of how it works in the private sector. So if someone decides to try therapy to improve their well-being, they have to visit their GP and a doctor, which is another barrier because they have to pay. So that for most doctors, it's somewhere between $100 or $120. They can get up to about $80 to $90 back, but that's still they can be $30 to $40 out of pocket. So then they'll see the psychologist for the 6 sessions. So in Australia, they get a total of 10 sessions, but you only get 6 with your first plan. And those are rebated. So a lot of people make the mistake that it's fully covered. Some psychologists will do what they call bulk bill, and then you don't pay anything at all. But there is a bit of a psychology to that. When services are free, people don't see the value in them and often will just cancel. And what happens is, as I've talked about in the childcare video, with Medicare, as a service provider, so my bulk of my clients do get these Medicare rebates. If the client doesn't show up, then we don't get the Medicare rebate. I don't have the heart to charge a lot of people that cancel. I know a lot of businesses and psychologists do, and that's part of the policies. Like I have as a policy too, but I rarely enforce it. But the mental health workers who are fee for service don't get paid if people don't show up. And then after those 6 sessions, which is a ridiculous thing, you then have to return to your doctor and get a review. So you have to pay that $120 again to basically have that doctor review that plan and just ask how it was going, check in, and then they'll give you the referral for the next 4 sessions. Now, I can see the logic to this, but this is a real drain on the finances of someone who, if we're talking about the missing middle, has moderate mental health issues. This is sort of unduly punishing them. And also with doctors too, that's filling up their books, which maybe they're not unhappy with, but having to do a review based on this for just another 4 sessions, so they only get 10 in the year. And then, as you can see there, what happens when people run out of their sessions? You get 10 sessions. If you're going weekly, your sessions run out in March. If you're going fortnightly, they run out in about May, I think, or June, like late May. And if you're going monthly, even monthly, you don't get 1 session a month for the whole year. Now, I will give the Liberal National Party credit. I know I'm very critical of them, but what they did during COVID, and I'll move to that image now. I've got to resize it. That's your millennial boomer there. During COVID times, it actually went up to 20 sessions in the year. So the 10 sessions per year is what it's gone back to now. And that's the 6-4 rule. So you get the first 6 with your plan, and then you get your 4 after you go back with a review. And what they've added now is you can have 2 of those sessions. If you're a parent with your child, you can have 2 parent sessions under the Medicare, or a support person can attend for 2 sessions out of those 10. But I have no idea why the Labor government rolled back that 20 sessions to 10. I mean, it should even be more. And if we look here with my declared favorite politician and someone who's doing a lot of good for Australia, Dr. Monique Ryan, the independent representative for Kooyong in Victoria, this quote here, that this was the budget, I believe, last year, was only $111 million for mental health services. And again, that sounds like a lot of money, but they gave the fossil fuel industries $14.5 billion a year in subsidies in the same budget. So the emphasis and the priority on giving these big corporations and mining companies their subsidies while everyday Aussies are struggling with their mental health and not having these properly funded services is just ridiculous. And another thing Dr. Monique Ryan has advocated for, which goes even beyond what I would say, because so for people who have eating disorders, that's for some reason its own Medicare code outside of the usual mental health care plan. And people with eating disorders will get 40 sessions covered by Medicare, which is essentially weekly, not fully weekly, but that's a lot of sessions that I think if you look at the stats, most people wouldn't use all of those 40, but a lot would. Dr. Monique Ryan has advocated to just remove the cap altogether because, as she said in her policy proposal, we don't ration GP visits. You can go to the doctor and get rebated as many times as you want throughout the year. As someone who's struggling with their mental health, still only gets 10 of those rebated sessions. Now, if they're using a lot of other services, there is what they call the Medicare safety net. And once you hit that safety net, you get a huge amount back. I don't know the exact number, but it's somewhere around 80 to 90%. So you can get a huge amount of your fee back, but you still only get the 10 in the year. And so the question a lot of people ask is, well, what do I do after that 10? Well, the government says, good luck. If you have private health insurance, which is hundreds, sometimes thousands of dollars a year, they often, if you have a mental health cover as your extras, you'll get rebates from them. But they're smart, and it's usually around $80, not close to the 100. So the insurance companies know what the Medicare rebate is, and they make theirs lower to incentivize people to use their Medicare rebates first. But essentially, once you've used those 10, the government says, well, it's not really our problem anymore. You can just wait for months in the public system with a psychologist that you have to tell your story to all over again. Because if you've chosen to see a private psychologist and they know your history and all of that, well, they're not going to cover your services anymore. And I just think that's unconscionable and pretty disgusting. And for an advanced country with the wealth that we have, I'm all for Dr. Monique Ryan's proposal to just remove the cap altogether. Maybe even let it run. Like, I know the governments love to just keep things to 2 or 3 years for their term. Why don't we just do that? Lift off the cap for private sessions and see what this average use of sessions per individual per year is. And I'm sure it's much higher than 10. And look, I don't think it would be up to 40, but that 20 number, again, giving the Liberal National Coalition some credit, they did do that during COVID. Now, they did that through a lot of necessity. They added telehealth as well, which has been made permanent, which is an amazing thing for people who can't physically get to a therapy room or an office. So they did do a lot of good. And they advocated to bring it back last election. There were so many other things I wouldn't have voted for them on that wouldn't have brought me to vote for that. But I think that's something that the Labor Party could do tomorrow and would make a huge difference to people's lives. Just bring back those sessions. And just the last thing on the private practice services. So really, private psychologists, as you can see there in Australia, can set their own rates. There's no mandated fee. But the APS, which is the Australian Psychology Society, based on all of the numbers, they recommend a fee per session of $318. So if you only get about a $100 rebate, you're paying $218 out of pocket. Now, there's clinical psychologists who get more of a rebate, so I think that's about $140 people get back. That still doesn't even cover half of the recommended fee. Now, I don't charge anywhere near that recommended fee. I actually charge $100, more than $100 less than that. But there are some psychologists who get up there as well. And as you can see, that's the issue, is that if we're going to offer rebated sessions or discounted sessions, which I do for a small amount of people, that comes at our personal cost. So, like with the childcare system, if children cancel or whatever, they still get that money anyway. Private, and this is healthcare wide too. I'm just talking about the mental health context. We're the ones who have to take that financial hit, whereas the public sector, those psychologists and all that, they just get a salary, and then people can come and go, and they're not really incentivized to do anything if people cancel. So that's where there's also a gap where there's a lot of empty spots, because they may have a wait list, but if people cancel on the day, then that's just all these empty spots. So this is a huge system and there's a lot to fix. And I look forward to doing a wider series about this and what can be done, because this is just a real broad overview of the system today. But what I would really love to hear is if you've had personal experiences with the mental health system in Australia, or if you have ideas of how to fix it, or you're an expert in the field, I would love to have a talk with you and have you on the show. Yeah, as an everyday Aussie, or I'm doing the everyday experts. I've already got a couple of great psychologists lined up where we can talk about the system and what can be done. But I would really love to hear about some experiences, and if you're willing to share your story, can put that into this series of videos, because I think it's really important. It's one of the biggest issues affecting everyday Australians, and it's something we're talking about more, but something I'm making my mission to share my knowledge and expertise on how we can make this system better and make it work for everybody, so no one has to suffer or struggle with their mental health issues alone. My name is Nathan Ogilvie. This is The Rightest Leftist, the podcast for the politically homeless, and let's talk again real soon.